Hi, I'm here with Austin Hunter, who is a psychotherapist and he practices out of Atlanta, Georgia. Austin, would you mind just telling us a little bit about yourself and what group you're with and all that?
Yeah. So, like you said, Austin Hunter, I am an APC here in the state of Georgia, and I practice with East Atlanta Counseling Services. We're based in Decatur, and I've only been there actually for the past month. Before that, I'd been practicing out of an office in Brookhaven. And prior to this year, I was practicing at Eastern State Psychiatric Hospital in Lexington, Kentucky. But I've got friends and family who all live in Georgia, so I decided to make the move down here.
So,
Prior to that, I studied at Asbury Theological in Lexington, Kentucky. That's where I got my master's. But I am an alumni of the University of Georgia, where I got my undergrad in sociology. So it's really good to be speaking with people at Georgia once again.
well, thanks for coming. So you're here to tell us about existential psychotherapy. So, what is existentialism as it applies to psychotherapy? Is it a modality, a philosophy? What exactly?
So existentialism would be a theoretical orientation. So you've got things that kind of lend themselves to being both a theoretical orientation and a modality of practice, like everyone's familiar with cognitive behavioral therapy. So you've got cognitive behavioral theory, and then you've also got the cognitive behavioral therapy. They kind of go together. Now, you can participate in existential therapy, but for the most part, that's going to be pretty open-ended. It's going to look more like the psychoanalytic work of someone like Sigmund Freud. And there's not a whole lot of people who practice that. In fact, that's not really what I do either. But instead, existentialism is the philosophical and theoretical underpinnings of everything that we do. So if you've ever studied the outcome effects of therapy, then you know that it's been found that almost 80% of therapeutic success is based off of the relationship. Then you've got another percentage that's pretty high, almost getting to 20, that is external factors. And about 1 to 3% is the theoretical modality. And so, although we spend so much time looking at what's the modality, what's the techniques, what do I do here, what do I do there, we know that that constitutes such a tiny percentage of change. Existentialism is really looking at that therapeutic alliance. So, the relationship between the therapist and the client in the here and now. Existentialists got their start from famous philosophers in Europe, such as Sartre and Nietzsche and Tillich. You might be familiar with Soren Kierkegaard. I mean, these are some of the big names that started the existential philosophical movement. And then you had people like Irvin Yalom, Viktor Frankl, and Rollo May, who ended up taking that and going, hey, this seems to have a whole lot to do with where minds go wrong. Where do we experience suffering? And I mean, of course, when you have people like Soren Kierkegaard who have gone so much into the nature of human suffering, it's only natural that people are going to start to apply that in a clinical context. So Sung San was a Buddhist monk. He was one of the first people to kind of bring Buddhism to the West, especially Zen Buddhism. And back in the 60s and 70s, existentialism was crossing the ocean from Europe. You had Buddhism crossing the ocean from Asia, and both hitting America in the psychological context at the same time. And there ended up being kind of a lot of overlap there. Even though they have incredibly different backgrounds, they have incredibly different approaches, is that they realize that an authentic here and now connection with your existence as you're experiencing it is the basis for not only consciousness but good health. Sung San used an example of a monk, and so this monk was out in the wilderness. He had been fleeing a conflict where his monastery had been burned down, and this is kind of one of those legendary mythological stories that we're not sure how true or false it is, but we know that there were monks that
What
fled
is
war
truth?
in Korea during the time. So what is truth? Yeah, and that this monk in the middle of the night had been pitch black, the clouds were covering the moon and stars, and he had not had any water in days and is on the brink of death. And grasping in the darkness outside of this ruined city, he finds a cup of water, just an absolute blessing from the heavens. And he drinks of the water and falls asleep and is content and feels very provided for. Well, in the morning, when he awakens, he looks to the cup that he drank from, and it was a shattered human skull. and it was writhing with the decay of flesh and the bugs swimming in it. And in that moment, that monk just retches. Of course, he's brought to nausea and he expels everything in his stomach. And it's said that at the moment that he vomited up that water, that he received enlightenment because he realized that the source of his suffering there was not the cup or the water or the battlefield, but his thoughts about it. That thought is the king of experience. So as Buddhists were kind of reaching America, the existentialists were reaching America
Mm,
with their thoughts at the same time, they reached this similar clearing that pain is just part of life,
mhm,
but it's our reaction to that pain that creates suffering. In fact, suffering is the distance of the space between your experience and the experience that you are wanting to have. And if you cannot allow your present experience to be valid, if you can't authentically connect with it, you're going to have a lot of dysfunction. You're going to be constantly disconnected, not only from the things you're trying to avoid, but from the things that are important and vibrant and beautiful.
So
Existential. Go ahead.
what was it that made that got you interested in existentialism in terms of therapy?
So I wasn't always an existentialist. When I came into my graduate program, I was much more on the cognitive behavioral side. I still have a lot of love and respect for it. I'm a member of the Association for Contextual Behavioral Science. I've done a lot of research with them, and that still comes in as kind of the tools. But I did find a lot of dissatisfaction in my early work, beginning all the way in my practicum and internships, with finding that from a purely cognitive behavioral mindset, uh, really you're just looking at symptoms. You're seeing somebody that comes in, they have a very
Yeah.
discrete problem. You need to go straight to that problem. If they're having thoughts that are creating these issues, you just replace those thoughts. If you're having behavior that's causing you issues, just replace that behavior. But it always seemed that outside of more acute issues, someone responding to grief or loss, CBT is really helpful. Someone responding to an immediate depression from an acute event that happened, super effective. But what about all those clients that just kept coming back? Ones that found that their issues, addressed from a symptomology standpoint, it was not really healing what was underneath those symptoms creating the problem in the first place. In a lot of ways, it felt like someone was coming in with a infection in their arm. We just kept putting bandages on it.
Mm,
Okay, we're just going to put, but what is underneath? What's going wrong systemically, deeper down, that keeps causing this? From an anxiety standpoint, which most of the things that we end up seeing are just some form of unresolved anxiety. It's
mhm.
how does this anxiety keep popping up in similar ways in all these different areas of your life? And as we address the symptoms, there's something underneath it all that's not being touched upon. And I found that existentialism really gave so much focus to the core principle of being alive, of the things that are consistent and common across all human beings. I mean, the four big sources of anxiety and dysfunction being death, isolation, responsibility, and meaninglessness. You're going to be hard pressed to find anybody coming to the therapy environment whose problems did not begin in one of those four sections.
Can you
And
say
that
those
really
again?
attracted me. It's death. And again, all four of these sort of operate as sort of dichotomies. So you've got death and impermanence. So
Okay.
things are only finite, the last certain amount of time they end. You've got freedom and responsibility. So making our choices, but also being beholden to the choices we make. Uh, Connection and isolation. So the fact that we go through life essentially alone. No one's mind will ever join your own, or how close you get, but also we desire that connection. And then finally, meaning versus meaninglessness.
Mm,
Recognizing that you kind of have to decide what things mean for you, even if some external source like a religion is giving you some meaning making. You have to be the one to attach to that and decide what matters.
okay.
So it sounds like what I'm hearing is a good portion of the modalities, like especially like CBT, are really more of a triage as far as treat what's on the surface as you can. But it sounds like existentialism is more of a deeper dive as far as it is. Am I hearing that right?
Yeah, it does triage. And you can really use your CBT antenna. You can use some of your behavioral antennas. I do that in your first few sessions. because most people come in, they're in immediate distress. They're looking for, I need help and I need it now. And addressing that from a behavioral standpoint, you can get some quick results. But once you get through the first aid, what's the deeper surgery look like?
Okay.
What are the deeper core issues that are causing us to need first aid constantly?
Gotcha. That
Uh,
makes sense.
so do me a favor, fill in the blank for me. If you blank, you might be an existentialist.
Mm. If you long for genuine connection as a co-pilgrim and co-journeyer
Hmm.
rather than as a medical expert, you might be an existentialist. Existentialism really throws out the idea that a client is coming in to see an expert who will understand their life better than they do and point out their issues. Instead, in existentialism, you're walking alongside them as another human being who also experiences the same stressors, the same sources of anxiety, and helping them to be the expert on their own life, to tell you what it's been like to be them, one existing human being meeting another existing human being and seeing the beauty that comes through authentically connecting in that way.
Now, you mentioned working at a hospital, right? A psychiatric hospital.
That's right.
How did your penchant for existentialism fit in there?
Oh, it was really tough and really beautiful. So
Okay.
I was in a wing of it. I was working with the severely mentally ill. So these were people with debilitating schizophrenic or schizoaffective disorders, debilitating personality disorders. Addictions usually were commingled and comorbid with these. And so you have a lot of people, everyone else on my wing was operating from a pretty manualized cognitive behavioral approach.
Mm.
However, what I found was when we got down beneath the hallucinations, the delusions, every single one of these people was just desperately trying to be okay and survive in the world they've been given. Of course, when you see severe traumas, like severe mental issues like this, there's trauma underlying it. None of these people woke up and decided that they wanted to be schizophrenic, but that by degrees over time, in order to survive the anxieties they felt from life, they had to construct an alternative world in which they could live where things that were happening to them made sense. All behavior is functional. Every behaviorist will tell you that, but they don't take a whole lot of time to look at what's the function that it's serving. We're going to
Mm.
create new behaviors that serve new functions. But for even the most debilitated person suffering from schizophrenia, that there is a core need to rectify their experience with what they want their experience to be. And so they may go to extreme lengths to do so. If you have an incredibly depressed human being who's suffering with thoughts of suicide, well, those thoughts of suicide are functional. They're trying to resolve an unresolvable anxiety. And the more that we cannot allow ourselves to feel anxious, the greater lengths that we will go to try and deal with that anxiety. And of course, in the hospital level, that's essentially what we're dealing with, is that people have gone to very extreme and extraordinary lengths to try and get rid of something they feel like they cannot have, the anxiety.
So, what I'm understanding, and correct me if I'm wrong, is that even if we are working in a facility or a practice that emphasizes something like a cognitive behavioral therapy, something with a lot of I, some people are going to disagree with my use of the word surface, but that's kind of the way I see it. You can still use existentialism. Is that what you're saying?
Absolutely.
Okay.
And I actually felt very useful, especially towards the end of my time at the hospital before I left to go into private practice, just because I felt like I had such a different perspective. And I really do appreciate the perspectives of people who are incredible practitioners of CBT, but that if you decide to go in a more philosophical, existential way, that you're probably going to be providing an angle and case conceptualization that other people just aren't, because it is such a radically different way of looking at the clinical environment.
And when you
Gotcha.
provide that case conceptualization from that viewpoint, I mean, in your experience, how is it received by those that come from a different philosophy?
It's viewed sometimes as a little bit slow, and sometimes it's viewed as incredibly courageous. So if you're going to be existential, you're going to need to be able to sit in the uncomfort, the discomfort of being anxious with your clients because you're modeling that for them.
Mm.
And you're going to need to sit with the present moment with your clients because you're modeling sitting with the present moment. Now, CBT is great because for managed care, you can knock it out, the whole manual, 8 sessions. Insurance loves that. They're going to want to push their clients through people who practice a short-term solutions-focused therapy. If you're looking at a characterological change therapy, something that's going to be addressing underlying things that create the solutions, things that create the problems, it takes longer. We're talking about months and months. I mean, the shortest time that I generally will see clients is a period of 6 months, because I know that it's going to take the first couple months just to realize what the concerns are, where the break is, what's the unacceptable anxiety. And at that point, we start to really do work to change characterologically how they engage with their reality.
Do you find that, I mean, do some clients come to you with insurance companies that will not allow them to do the kind of work you want to do? And if so, how do you do the best you can in that instance?
I've yet to find an insurance company that would not allow someone to go to an existential therapist. The issue is they're going to give you the same time limits that they give your behavioral counterparts. And so one of the big reasons that I did move from hospital work to private practice, although I'm still seeing very similar clients, is that I don't have the stringent time limits any longer. That if we go beyond 8 sessions, and we almost always do, we can keep going. We can keep working together. We can keep journeying on the same path. Whereas if you are in a hospital environment, you can definitely practice existentialism, but you have to be very creative to try and get the most use out of it as you can in the limited time that an insurance company will give you.
Okay.
So the way you're describing, I'm jumping in, my turn.
Yeah.
So the way that you're describing it, I'm kind of hearing like a micro systems, instead of looking at macro systems, but looking at micro systems within the person. Am I hearing that correctly? Is that a way to conceptualize it, or am I off?
You are looking at micro instances in order to understand the macro system. So
Okay.
existentially, the human being's life is an irreducible unit, meaning you can't break it down into, well, here's the part of you that had trauma, here's the part of you that has these anxiety, here's the part of you that feels depressed, but that the person is one whole. Everything that they've experienced, and you are able to witness that and treat that in the moment. So for an existentialist, the greatest source of therapeutic grist for the mill is going to be the interaction that you have between yourself and them, the I thou. You know, if someone comes in and they're talking about their life, about a broken relationship that they have, well, it's impossible for us to know if what we're being told is 100% accurate to the situation. And in fact, even a human being who's trying to be forthcoming and truthful just cannot present 100% accuracy. They're going to be seeing things from their own biased or skewed perspective. But what both the therapist and the client can both share with 100% accuracy is their in the moment relationship. The way that those issues present themselves in therapy is going to be a microcosm of the way that that client interacts with their life in general. And that's going to give you the information that you need for treatment.
Gotcha. All right, now David, it's your turn.
Okay. Do you have any more at the moment?
I kind of had, I did have a follow-up on that one,
Yeah.
because I'm trying to wrap my brain around this not modality, but this conceptualization. And I'm pulling from a limited amount of experience. You know, I've got access to DBT and CBT, and we just had the talk about IFS our last session. And I'm hearing a lot of I'm hearing a lot of strings that are connected. Like I can see with the different, looking at the dichotomy with the combination of DBT, and I can see the influence there. And I'm hearing that you can't separate the whole, and that sounds a lot like IFS in some ways to me. And the triaging, of course, there's that piece of CBT. I'm just trying to drill down to find how it's different. Oh,
Absolutely. And the places where it's similar is very important as well, because as I was kind of saying earlier, between the Zen and existentialists, is that the pathways that we take to get to these conclusions are much less important than the clearing we all find ourselves arriving in. And I use that metaphor all the time because I just think it's so important that you are noticing that there are commonalities, there are strings connecting all these different theories together, because where we sit in the middle is what is important, is where we recognize, hey, we're all doing the same work here. Um, Existential relationship is really only going to separate from that in so much as you're enabling a very philosophical approach to come into the counseling environment. So you're going to address philosophically, how do you engage with death? How do you engage with the death of different identities? How do you engage with the loss of different periods and aspects of life? How are you looking at your choice and asking the big question that most modalities are not going to allow you to ask? And it's why? Viktor Frankl, one of the big names in existentialism and in logotherapy, another sort of off branch of existentialism, he says the person who has a why for their life can deal with any how. You know, CBT is going to give you a lot of hows. DBT is going to give you an entire tome of hows. But I find time and time again that when I complete a DBT course, that people seem to do really well for a few months afterward until something new and novel happens. And they no longer have a very strong why for continuing to do those very difficult hows. Why would I use these skills? And the why is something that takes a very long time and is constructed by the individual in such a way that we generally don't give space to in American culture or in the counseling room, because it is a very painful question. Most of the time, a person's coming to therapy because they're not sure how to answer the whys of their life and they're actively fleeing them.
well, and from what I did, my quick little deep dive, shallow dive really, it looks like you work with adolescents. And that point of time, I mean, the why is the over, or at least from my understanding as a parent of teenagers, that why is the overarching driver for their entire existence at that point, it seems. Do you find in general that the teenagers are asking more whys than the adults are?
Mm, I think that the teenagers have not been beaten down by others for asking their whys for quite so long, and that it has not been stigmatized to not have an answer for the why. And as adults, we are much more likely to operate under the assumption that we know why we do what we do. Because if we were to kind of peel apart that onion and look at it, it's much too uncomfortable. And we've either been given systems externally or just come to a foregone or foreclosed conclusion about what our whys are. And those might not be working for us, but it is very improper and usually unprofessional or demeaning for someone to admit, I don't know why I do what I do.
Okay.
So what modalities do you work with, and which do you avoid too?
Oh, I don't know that there would be any that I would explicitly avoid. I haven't really come across in my career any modalities that I would go, oh, that's just terrible. Don't do that. You know,
Okay.
occasionally I'll meet a Gestalt therapist and I'll just go, wow, that's really aggressive, but I hope that it works for you and it seems like your clients do well. But I incorporate a few Gestalt techniques in. I mean, I'm an ACT therapist mostly by the most enormous amount of training. And ACT is also something that is, for me, a great bridge between the philosophical existentialism and the practicality of CBT. But it keeps in mind that there is an underlying avoidance of anxiety that's creating most of the issues and pathology that we run into. And so it's not thought replacement, but it's sitting with the thoughts and the emotions that you do have instead of needing to change them or judge them. So I use a lot of ACT. It's acceptance and commitment therapy. And so I would primarily use that for any new client that's coming in. I'm going to be looking at it through an ACT modality technique lens. But I also teach DBT skills courses, because I know that for some people, and DBT is always partnered with an individual therapist, because you have
Mhm.
to make it personal, you have to make it real for that person. But a lot of times, you know, it's like they're is a deficit of skills, especially if you're of a disordered personality. You likely never learned the skills that are required for you to thrive and engage with your life. So DBT is, of course, just incredibly behavioral. Do this, do that, look for this reaction, look for that reaction. And ACT as well is we're figuring out what is important to you. And it connects with the construction of the why, of the meaning, is what is meaningful and important to you. And regardless of where that's come from, is it still meaningful for you to connect to that, or have you had to forego connecting to what's vital or important or life-giving in order to deal with whatever pathology you have?
One of the things I assist with a DBT course. And one of the things I find that kind of lends itself to the existentialist mindset is the mindfulness portion. You know, it holds that space, and this is why I like it. You know, it teaches all the skills and all those other sections, but the mindfulness area really holds that space for the client to sit with whatever it is they need to sit with, you know, to clear their mind and you know, there's lots of different kinds of meditations. And so that's what you know, I think really works with that. And I'm curious, with your DBT skills course, do you see that as well, or do you have a different experience?
Absolutely. So every DBT skills course will begin the group session with a period of mindfulness. Now, the way that each different practitioner approaches that is going to be different. It might be just functional. We're trying to get connected to the space to clear out whatever distractions are going on. But for me, I have found that in my DBT courses, that the small moment of processing after being mindful is often some of the most beneficial, change provoking, life giving moments of our groups. And that we can all sit there and allow ourselves to be ourselves for a moment in such a way that we're modeling, teaching, showing that you can sit with any feeling, even if it's painful, even if there's distractions going on, even if you have physical pain in your body, that pain does not have to equal suffering. And if we can teach that in the small moments for 5 or 10 minutes of sitting with whatever discomfort or pleasurable, whatever joy or anxiousness, whatever is present in that moment, to just be with it together and voice that tends to translate to an ability to be congruent with your experience in the external world when you're not in the therapy room.
One of the biggest challenges I've been working with in my clinical is dealing with mandated versus voluntary clients.
Mhm.
And I wonder if that specific aspect, because it sounds like you've worked with both, has had a significant impact on existentialism as your approach to therapy.
Yes. Uh, I led my first DBT groups that I led were for court mandated clients. They had been sent there through drug court in Lexington, and without fail, none of them wanted to be there, but they were required to, or else they would violate their parole or probation. And I think that was kind of a greater goal for them, was not going back into the system. And so, there was varying levels of attendance, but for the most part, people would show up. Allowing them to be there, not trying to convince them that they want to be there. Because that is so much of what they'd been shown in the past, is that I have to want these unpleasant things. I have to change my desire from wanting something else. But being able to release that want and go, yeah, my goal isn't for you to want to be here, but to show that you have the skills, the strength, the courage to be here without suffering, that you can sit with yourself in these times. And a lot of times that kind of just gave clients the space to figure out what it is that they did want from their life. What is it that coming to group therapy was in service of? Because if you're just coming to group to come to group, that's a very shallow experience. It's not connecting with anything vital. Most of them, of course, you're not going to be able to convince them that they want to be there. But you can give them the space to figure out, by being here, I'm enabling myself to also be blank. I'm enabling myself to move into X. And from that's when I saw the most success.
That's encouraging. Thank you.
Mhm.
Who are some of your existentialist heroes and why?
Mm. So number one, of course, is going to be Irvin Yalom. So if you've never heard of Irvin, I really recommend that you look him up. He's written some excellent fiction. One of the books, if you are interested in going into therapy, give When Nietzsche Wept a look. It's a story of Nietzsche trying to seek out his own psychotherapy after the loss of a very important relationship. But Irvin Yalom wrote what would be considered the Bible for existentialists. It's called Existential Psychotherapy. Gigantic book, but every single page is worth reading, in my opinion, because it does break down those four core anxiety concepts down to their minutia and shows the ways that they present themselves in therapy, ways to connect to them, and then also gives a lot of external references to different modalities, techniques, other work done by just very practical, functional therapists on what to use there. And it's something that I end up referring back to all the time. If you want sort of like a quick primer on existentialism, if you're not sure that you want to really jump in all the way, then Martin Adams and Emmy Dwerzin wrote a book called Skills in Existential Counseling and Psychology. So that one's just like very short. They're kind of the more modern approaches. Irvin Yalom wrote his book 40 years ago, probably 30, 40 years ago. And so you might find that there's some more contemporary language that appeals to you from Dwerzin and Adams. Now, Viktor Frankl, his book Man's Search for Meaning is one of the big ones. That's actually the first book that got me into existentialism. It's someone recommended based on some dissatisfaction I was experiencing at work from a CBT lens. And you probably want to read this. So if you have been looking at sort of the manualized therapy and it kind of gives you a bad taste in your mouth, give Man's Search for Meaning a read and it'll probably give you some good direction. In addition, Eric Fromm, you've got Sartre and Soren Kierkegaard, as I talked about before. If you like Carl Rogers and you like person-centered therapy, well, person-centered therapy really developed from an existential lens. He was one of the first presidents of the American Psychotherapist Association, to be differentiated from the American Psychological and Psychiatric Association, but the psychotherapist. And they did a lot of work on incorporating continental European philosophy into the therapist room, which led them to develop humanistic psychology. Rollo May and his book, The Meaning of Anxiety, is another just incredible foray into what I was talking about earlier. Kind of most of what we see boils down to anxiety. Rollo May there took the approach that, if we go in from a medical model, looking at the way that the mind works, that there are noxious and potentially damaging agents all the time within the body. But if you were to remove all of them, the human being would die. For example, your gut bacteria, that we exist at a sort of homeostasis with something that would be considered deadly or damaging, and yet it is incredibly vital to our life. In the same way, anxiety is vital to our life. If you had no anxiety, you'd never know you were hungry. If you had no anxiety, you'd never know what you enjoy and don't enjoy. If you removed the anxiety completely, then you would no longer be a living being. You'd be a stone. But when that anxiety gets out of equilibrium, what you have is dysfunction, that it either overwhelms the defenses or creates a problem that we have not been hitherto prepared to deal with. And the anxiety rolls over and starts creating issues for us. So Rollo May's Meaning of Anxiety is just an incredible foray into that idea.
With so I just finished Man's Search for Meaning, and I found I mean, it was fascinating. And the structure was really interesting because the first part is it's a little mini biography of Frankl's time in the camps. And that really, I mean, that's fascinating in and of itself, but it's like you're watching him employ the techniques or the philosophy of logotherapy. You're watching him in the camps do that, and you're hearing his mindset as he's doing that, and you're seeing the contrast and comparison with others in the camp and how they respond to the difficult and horrific situations that are in there. And I found that, and so I read that and I was like, okay, I'm hooked. I got to read, these other ones. And I started to read about Frankl. And I was reading, I think it was him and May had a little bit of difference of philosophy. Is that right?
A little bit.
Okay.
Frankl leaned really hard into paradoxical intention, or if you are experiencing some negative symptom, then what we're going to do is make that appear as greatly as possible. If you got the shakes, we're going to make you shake it out. And Rollo May found, like sometimes that can be helpful, but if you have someone who is having a debilitating or self-injurious behavior and you encourage them to increase that to the max, you might just terminate the organism. So please don't do that. And so I know that they ended up having some tiffs, but they agreed on much more than they disagreed on.
Okay. All right. Was R.D. Laing an existentialist?
I'm not familiar with Laing. So
Okay.
I'm not sure.
All right. Heather Lee, I see you had something.
I do. So obviously we're looking at existentialism on the organism as a whole and looking at the different dichotomies within. So I'm curious as to how wow, don't hurt yourself, kid. Existentialism, there we go, views some of the larger wicked issues and how it incorporates things like systemic racism. How do we work with that within the existentialism mindset or frame or lens?
That's a fantastic question. I think that existentialism allows for the development and evolution of the clinical practice and of social engagement, because you are trusting people's experience. You're validating the oppressed. You're validating those who have suffered under the weights of and the mechanisms of our system. And when a person is the expert over their own existence and they're telling you what has happened to me, what has happened to people like me has created intense suffering, well, now the therapist knows, like, it's part of my ethical duty and obligation in order to promote the well-being and help this person to figure out how they can be well, and also to create an environment in which their experience is able to change. If we are hearing people saying, well, I have experienced this as an incredible pain that I, because of the color of my skin or because of my sexual orientation or because of my religious background, have been persecuted, oppressed, or damaged by the systems that I'm in, then we're going to come alongside them and say, yes, like, this has been incredibly damaging. And it's not that we need to change you, but we can help you not to suffer while we modify the system that creates the pain.
That is a big ship that takes a long time to turn.
Oh, absolutely. Yeah, it's a very, very difficult process. But again, it's why we don't do manualized therapy. It takes more than just 8 weeks.
Okay. Yeah, that's something that I'm constantly looking at, is the interaction of different systems and how they reflect on people's identities and how they lock in. So that was something I was definitely curious about. Thank you for the answer.
Yeah, and an addendum to
an
that.
answer, not the answer, but an answer.
An answer. An addendum to that is that existentialism is not big on diagnostics or labels. And so while you can find some helpfulness in a diagnosis that can give a little bit of understanding to what someone's experience is, no two people diagnosed with the same mental illness are going to experience it the same way. In the same way, someone's sexuality, their ethnic background, their racial background, is that you can have two people who would identify with maybe the same label, but they are going to experience it in very different ways. And existentialism says, I want to find out what that's meant for you. If you are gay, or if you are African, or if you are straight, or if you are Christian, or if you're whatever label we said, it says, yes, I hear that label and this is what it might mean to me, but what does this mean for you? How has this played out in your life?
Hear that, and working with the different non-labels, but getting to the heart of the definition of what those labels might mean to your client, it stands to reason that there's probably quite a bit of fluctuation in your own mind as a therapist, as far as, just use the example, what the word gay means, what it means for, client A through Z.
Mm-hmm.
It might mean something completely different to all of them. And how do you hold that space for yourself as you're journeying through with them for your own definitions?
With my own definitions, what I've come to find out is both being in the clinic and just being in my life is that my experience emerges moment by moment. If I am too anticipatory of what these labels might mean for the future, I have anxiety. If I'm too preoccupied with what they mean for my past, well, I end up in depression. But in the moment, everything just emerges one moment at a time. What does this mean? How am I experiencing my life? What is it that's important? What is it that's causing issues? And not that I need to have a definitive definition of who I am, because a moment later it's now going to be antiquated, no longer as useful. But to be able to accept and experience myself as I am in this present moment is the foundation of health.
So it sounds like you're giving yourself permission to flow through and to change as needed on a moment to moment basis.
Right.
Okay, thank you.
Yeah.
Well, Heather Lee, do you have any other questions?
Those are the ones that I have off the top of my head right now. So
Okay.
I wasn't trying to trip anybody up, I promise.
No. The reason I ask is I thought we could do just a little bit of a demonstration. And Austin, if you would provide some commentary as you do it, I think that might help us. So if you start to use a tool from another area, point that out. Because I think one of the things that I want to make sure that our audience understands and that I understand is how it works with different modalities and all of that, and why we should consider learning about existentialism as well as the different modalities that are appealing to us. So would that be okay?
Absolutely. Yeah, let's give it a
Okay.
try.
All right. And Heather Lee, do you want to be the client? Should I be the client? Should we both be the clients at the same time?
I mean, I'm always game for role playing when it comes to case studies. So I'm always good for that. Just
let's do that. Yeah, I forgot
okay.
You got the acting bug. Okay. All right, take it away.
All right. So basically coming in. All right, let me think of a scenario.
So we'll shoot for 10 minutes, I guess.
Okay.
Great.
All right. So hi.
All right.
Here.
Now, are we going to be playing a moment where this is our first time meeting, or have we been meeting together for some time?
Let's go ahead with we're meeting for the first time.
Okay. Heather Lee, I'm really glad that we were able to make this time work to come together. What has been directing you to seek out therapy today?
I can't get my feet underneath me. I don't know what I'm supposed to be doing or when I'm supposed to be doing it. And I don't even know what I want to do anymore. There's so many demands on my time. I've got to take care of the kids. I've got to do the schooling. I've got to keep the books for work. I've got an internship. My partner asked me the other day, like, all right, you're gonna get done with this program and you're gonna jump into a job and we're gonna have two incomes. And I'm looking at him and I'm going, I know that was the plan originally, but I still don't know what I want to be when I grow up. And I'm having time on my plate to just jump into a job when I'm juggling everything else. I don't even know what I want for myself, much less where I want to be in, 6 months to a year. I don't know. I don't have a specific reason outside of the fact that everything is fuzzy and overwhelming. And so I'm here.
So as an aside, in that moment, there's three things that I would pick up with an existential antenna. Number one is that I would be honing in on, and the next question that I'll follow up with was, wow, that was a lot to be going on in your mind all at once. How does it feel right now to be sharing those details with me? So that's going to be the first follow-up, is to bring it to the here and now. Okay, so there's all these things going outside. These are important. These are vital. They've brought you into being here. But the actual sharing of these issues is going to give us a lot of information about how you're experiencing them in your life. But I can't tell what it's like for you to be in an argument with your
husband.
partner. In an argument with your partner, I can't tell what it's like to be interacting with the children or with your own hopes and dreams, but I can see the way that as you talk about your issues, it comes up here. The second thing, and this is not something for a very first session, but something that we would round back to later on, was as you were sharing that you don't even know what you want to do or how to have that conversation, you started to have this little like smile, like, I don't even know what to do there. Instantly, there's a break from your experience because what you're expressing to me is something of deep sadness. And yet, what you're showing on the affect level is laughter. Those things aren't congruent. Now, I'm not going to sit here and confront you in a first session and go, why are you laughing when you say sad things? But I'm making notes of these things because we'll come back to them because it's probably likely that if you're doing that when you meet someone the first time, that you do this in your life elsewhere as well. Now, the third thing that comes up there and the things that I'd be making notes of was you talked about specific areas of very strong importance of your life, this relationship, your children, and career. So we're going to see how attached or detached are you from those meaning making sources in your life. Is your anxiety, dealing with your anxiety, causing you to have to avoid or disconnect from them? Or are you still connected to them in a significant way? And how can we improve? In this moment to share that with me?
Hello? You know, I'm not sure. It feels kind of like a waterfall, like a torrent that's just not, I can't stand up in. But as far as saying it to you, it's heavy.
Mm,
It's like a part of me wants to just take all of that and just throw it out the window and go someplace else. But it's the reality that I have to deal with. So it's here. I don't like it. I don't like I don't like having to talk about it. But it's what I have to talk about. So does that make sense?
yeah. Right now, as you feel that heaviness, like being burdened by a waterfall of emotion, seems like it has a direction to it. Feels like you
Yeah.
want to you
Well,
want to go somewhere else.
yeah. Sounds about right. Where? No clue. But
Mhm. Where in your life does this waterfall feeling make the greatest appearance?
mm, what's expected of me? Like what's expected of me as a mother, what's expected of me as a partner, what's expected of me, pretty much. So external. But those expectations, even though they're coming from outside, coming from society, they still feel like they're coming from inside at the same time. That's that's odd.
So right
So
there,
can I say both? Can I say
yeah,
external and internal, but maybe they're the same thing?
right there as an aside again is taking that in the moment feeling and going, okay, and where does this connect to your life outside of this room? So you've had this feeling as you're sitting here, and this is making an appearance in other places. Um, and you were talking about the internal and the external. There is that there is a movement to avoid, to get away from, to want to disconnect from the experience that you're having. And so that's going to be, again, a lot of grist for the mill, is looking at when you move towards your life, you have a desire to flee away from it. And where are the key areas, the cruxes where that's mostly taking place? So following up from there, of course, being a first session, we're not going to be just diving in. I'm not going to be kind of asking you to tear things open and tell me all about that, but continuing to gather information that uh, internal and external, open that up for me a little bit more. What is the difference between those?
So I only inhabit, this meat puppet, but trying to figure out kind of identity thing, like who I am. I mean, got all of these different identities, you know, but it feels like maybe there's others that I haven't explored or don't have time to explore. And it's, I don't know, it feels like I can't, if we go back to the waterfall, I can't go swim down the stream because I'm stuck under the waterfall. I'm real big on it, on water imagery today, apparently.
Mhm.
Um, I'm actually not even sure I answered your question. I'm sorry. It's just kind of where I am right now. It's just stuck.
It seems like when we start to talk about what is going on in your life, your mind keeps coming back to this place of stuckness, of weight, of
Mhm.
heaviness. So, as an aside again, there was a lot of language of identity. And that's paired with earlier, you were saying what people are saying you should be doing. And so now we're developing the difference between your life, your experience, your existence, and the one that it's supposed to be, whether that's been decided by yourself or by other people, is that we're going to find suffering exists in between those two spaces, that for the most part, as you get up and there's things that you want to do, a person that you want to be, but you're being confronted with the person that others in your life are telling you have to be, that the more that happens, the more that you will suffer, because you aren't this thing over here. This is what you are. So looking at from that side, a lot of different directions to go here, because this is where like some more technique oriented things would be identifying, are we going to move in a DBT direction that you just don't have the skills that you need to navigate being the identity that you're living, or is this more of a, I know what to do and how to do it, I just really don't want to. And so as a result, like I am continuously separated from my life. I might go in a more act direction there. Additionally,
Okay.
there's a whole lot underneath this that we could probably eke out. You could go in a narrative therapy direction if you're familiar with that, and try and figure out what is the story of how these different role identities you have came to be, and where did those come from.
Okay. Very cool.
Wow, I really liked uh, how you really illustrated at the end, like the fork in the road, like if this, what, how you determine what tools you're going to use. That I've not seen that in my program yet, explained quite that well. So
Yeah, that is new. Thank you for sharing that.
yeah,
Yeah. Hopefully that
okay,
was a little bit helpful.
It was, yes, thank you.
yeah. I was riveted, like watching that happen, even though it was you know play acting, so to speak. But watching how you would do that, and then watching Heather Lee's reactions as to what you were saying, that was fascinating. So before we close out, I would just want to see, is there anything that you think we should know or read or do, or any speaker we should check out?
Mm. You know,
Mhm.
a few weeks ago, David and I met up and we're discussing the last event that I came to on understanding suicide, and then talking about potentially coming here, and we're talking about eclecticism and how eclecticism has become sort of the main theoretical approach of so many practices now. You know, whether whatever program you're going through, is that most people are kind of pulling bits and pieces. And I don't want to say not to do that, because I think it's so important to understand what all the different theories have to offer. But I really want to encourage anyone who watches this, any students currently looking at becoming a therapist, is to dive deep into a theory. Because when you pull each of the little pieces from lots of theories, what you end up with is a lake that's a mile wide and an inch deep. Is that you know just enough to get in trouble about every different theory. But when you really commit yourself to understanding the fullness and the beauty and the rigor of one specific theory, you'll find that your work will really benefit. Because there will always be times where clients come in and say things that throw you off, or that they do not respond in ways that you're anticipating. And in that moment, you can either, really struggle and flounder and figure out, oh no, I don't know how to help this person. Or you can come from a place of real deep comfort and stability in your own existential or whatever you choose orientation theoretically to go, we can sit with this. We do not have to know what to do all the time so much as enabling ourselves to be exactly where we are.
Okay.
So if you choose CBT, really learn CBT. Go beyond Beck. Read all of the more recent. Go all the way back to Skinner. Read about how behaviorism came into place. If you want to go internal family systems, commit yourself to it. Read the literature. Go on Gestor and look up all the different articles that have come up about the research. Find out how this is playing out in the clinical environment, in the social environment. That you almost do yourself a disservice if you graduate your program without knowing the fullness of the theory that you're going to practice. Because once you're in the field, you're going to be doing it. And while there is a lot of great natural development in understanding how to approach therapy, the more work that you can do to fully understand all the minutia of what underpins what you're doing, the more comfortable you're going to be when you do it.